Hi, I'm Deepak Bhatt for ACC.org, reporting from Barcelona, and I'm privileged to be here with Dr. Beauvais, and we're going to give you an overview of what we think will be hot before we know the results. So, Fred, what's going to be hot?
Well, first of all, the weather. You know, it's very nice weather today, and I think we're going to have a great meeting, a big crowd, and lots of interesting things going on. We've been hearing an awful lot about Paradigm, the study of a new medication in heart failure, so I think we're going to be anxious to see the results of that. In the area of heart failure, we got a couple other things. We got iron therapy in heart failure, we got vagal stimulation in heart failure, so be some exciting heart failure studies.
So heart failure is pretty big here, and Paradigm, we've sort of heard a bit about it just from the press release that's been reduced, so we know that the trial is quote-unquote positive, that is, it met its primary endpoint.
Right.
But what we really want to see is, are there reductions in mortality? Some of the leadership of the trial has hinted about that, so we just got to see if it really is true.
Well, plus it's a new mechanism. You know, it's a peptidase mechanism, which is something new that we haven't had for heart failure. So that'll be exciting.
And you mentioned the vagal stimulation, so that I think is also exciting, a device therapy for heart failure with a sham control, so a rigorous evaluation of a novel therapy in heart failure.
Right. So I think we're seeing a couple new novel therapies in heart failure which we haven't seen. So that's going to generate some excitement at the meeting. We have more on the series in pericarditis. I think
yes.
You know, we've got a couple of papers published on pericarditis with colchicine, and I think the authors of those papers are presenting some data on post-op pericarditis and post-pericardiotomy syndrome with colchicine. So that'll be an interesting area to look at as well as we watch the data coming in.
That will, though the bar I think will be a bit higher for these studies where we're talking about prophylactic colchicine to reduce post-operative complications. So should we really give it to everybody post-op? I think the results will need to be quite robust to justify that.
Right, and I think that's, to date, you know, with the original studies in colchicine, leaves us with some idea that colchicine is useful.
Right.
Whether it crosses over into the post-surgical area is going to be another interesting area to look at. So
Agreed.
some good topics in that area.
Absolutely. And there's some interesting stuff in the world of stents also, where one type of stent is being compared to another type of stent, in particular examining these biodegradable stents and biodegradable polymers and seeing how they compare against the current standard of care. So that'll hopefully advance the field of stenting a bit further.
Right, I've been impressed because I started out with the original TIMI studies with balloon angioplasty, watching a 50% restenosis rate being reduced down to 15 or 20%. Now we're down to 5%. It's really exciting to watch the new technology of stents moving forward, so that we basically can be pretty comfortable when we put a stent in with a biodegradable, with drug, without drug, that we're getting really good results. So I think those are exciting studies.
Yeah, the bioscience study in particular is examining an ultra-thin stent with a biodegradable polymer, seeing how it compares against a current second-generation drug-eluting stent.
Right.
So it'll be interesting to see if it's better or not.
Interesting to watch how that one goes as well. Something about ticagrelor outside the hospital?
I'm glad you mentioned that one, the Atlantic trial, and that is ticagrelor in the ambulance, essentially, for patients with STEMI. So does ticagrelor pre-treatment work? And in the US, we're not so big on pre-treatment in the ambulance, but in Europe in particular, in some countries they'll give lytic in an ambulance. But here the idea is to see whether giving ticagrelor upstream in the STEMI patient prior to primary PCI is better than just giving it in the lab. And it'll be interesting to see if that shows anything.
Right, so we're looking forward to some interesting data, some new things that will help practice, new information on overall patient care, and some new technologies that come down the road with, particularly in the area of heart failure, with some new therapies that we haven't seen before. So I think we're looking forward to a pretty interesting set of presentations this week.
I agree with you. These are important trials. They have the potential to change practice, a paradigm perhaps more so than any of the others we mentioned, but even the others in terms of advances in other aspects of heart failure care, advances in PCI and STEMI. These are common conditions worldwide, so any advance could be important. Great, well, thank you for listening to this recap of what will be presented at ESC. We'll see if any of our predictions of what's hot or not come true.